Hey guys, it's Brandon Gustafson. Welcome back to Assisted Living Investing. Happy to have you on the channel today. I just want to make sure that you are liking, subscribing the videos, and following me on my other social media platforms. And make sure you check out assistedlivinginvesting.net. I'd love to have you over there. Check out the free resources and subscribe to my newsletter for future content. The last 4 videos, we've been talking about my calculator and doing kind of a really in-depth overview of how to use a tutorial on how to use a calculator, how to underwrite an unassisted living facility, my process that I go through. I hope those videos were helpful to you. Make sure you go and check those out. They should be up here in the cards. And make sure you give me some feedback on that. Was that helpful for you? Is it something that is helping you understand kind of the process of underwriting and understanding what it's like to underwrite a facility? I'd love to see your comments and see what I can do to help you out on your journey to purchase your own assisted living facility. Today we're going to talk about what are Medicaid and Medicare. Just kind of give an overview of what they are. Next video we'll be getting into how they impact assisted living, but today I wanted to give you a quick overview of what they are, how they work, and just give you a good understanding of what Medicaid is, what Medicare is, how people qualify for them. Just so you have a good base understanding of exactly what those programs are, because as you get into assisted living, you're going to hear these terms thrown around, and you might be a little bit familiar, but I think a lot of people get them confused. So I want to give you some clarity on exactly what the 2 different programs are, because they are different. They have a lot of differences in them, and I just want to make sure that this is all clear for you so you understand what you're getting into. So first off, what is Medicaid? Medicaid is our nation's public health insurance program aimed at serving people who have low income. Medicaid is a federally funded program, but it's administered at the state level. So each state has their own flexibility to administer the program within the mandated federal guidelines. So they're able to kind of make some decisions. Budgets are approved at the state level, and they are then administered by the state. A person qualifies for Medicaid in large part because they meet a low income threshold, or they have something that causes them to need Medicaid services for medical reasons. So it could be a variety of things. I'll get into that here a little bit later in the video. So that's Medicaid. Now, what is Medicare? Medicare is also a federally funded program, but it's administered at the federal level. So you probably have heard of CMS, which stands for Centers for Medicare and Medicaid Services. The director of CMS is actually appointed by the president. So President Biden has appointed somebody to head up CMS. President Trump did that prior to that. Every president has a person. And a lot of times you'll see former directors of CMS go out and they create really cool, innovative companies within the healthcare space. So CMS has a really good track record of bringing in good, very intelligent people to head up the program. Regardless of your political views, there are some really cool things that come out of CMS. With that said, CMS is a federally funded, federally administered program. It's slow moving, it's cumbersome. That's just a part of what it is. A person will qualify for Medicare when they turn 65. And there are several different parts that make up Medicare. So there are several different parts that make up Medicare, and you may have heard of some of these. So Part A Medicare is for inpatient or hospital visits. Part B, as in boy, is for outpatient clinic or specialist visits. And Part D, as in dog, is for prescription drug coverage. So those are kind of the big 3 main parts. But you may also hear of things like Medicare supplement plans or Medigap plans. It's actually a lot of what I do in my full-time job is kind of work on those things. Medicare supplement plans are plans that supplement a beneficiary's care by helping take care of healthcare associated costs like copays or coinsurance, deductibles. Some are getting to the point where they're offering some innovative options to the plans, like including vision and dental care. Now, none of these parts of Medicare cover long-term care. Part A, B, D, Medicare supplement plans, none of those are going to take care of long-term care. And that's where assisted living falls in the landscape of healthcare. So none of these parts, Part A, B, D, Medicare supplement plans, none of them are going to cover long-term care. And that's where assisted living is going to fall in the healthcare landscape. So your assisted living facility you're not going to be dealing with Medicare. Your residents will have Medicare. It's very likely that they'll have Medicare, but the coverage that they have, their Medicare coverage, is not going to be something that you're going to be receiving reimbursement from. It just those services, those healthcare services, they don't overlap. So that's something that you'll want to be aware of. Medicaid, yes. Medicare, no. So who is it that qualifies for Medicaid? The first group that qualifies for Medicaid are low-income families, and this could be people that make low income. There are certain like economic thresholds, and each state is different. You may have heard when President Obama was in office, the coverage gap and trying to expand Medicaid. That was to hit those people that fell into this gap where they made too much money to qualify for traditional Medicaid, but they didn't make enough, so they couldn't get things through the healthcare marketplace. So that was the gap in coverage. So families that need assistance because they kind of fell into that gap or they fall below this threshold, they were able to get Medicaid. Children, there's a program that is called the Children's Health Insurance Program, CHIP for short, and that is going to be specific to children that need care. And then another one is pregnant women. So pregnant women can actually kind of fall into the CHIP program. It's not called that. I can't remember exactly what it's called. But they can kind of get Medicaid benefits to help them out through prenatal care, even the delivery of their baby. So those are some options for low-income families. The next group that can qualify for Medicaid are individuals that have disabilities. So this could be children with autism, cerebral palsy, HIV and AIDS, or mental illnesses. So one of my facilities is a mental health facility, the one in Colorado, and many of our residents there qualify for this type of Medicaid. So they deal with just various different types of mental illnesses, and they qualify for Medicaid through the mental health portion. And the last group that qualifies for Medicaid are elderly individuals. So this could be Medicare beneficiaries who need assistance paying for Medicare premiums, for example. Maybe they fall into that gap and they don't hit that threshold, and so they need assistance. So Medicaid can step in and help them make those Medicare premium payments that they need to make. It could be a community waiver participant. So in Utah, this is called New Choice Waiver. There are other waiver programs throughout the nation, but the waiver program is approved and it's funded by the state. And a lot of times you're going to see assisted living falling into this category for the type of reimbursement that you're getting. It'll be in a waiver program. The other one is nursing home residents. So nursing homes and assisted living are not the same, but they kind of fall into this group that is institutional care or long-term care. It's there for the long haul. So Medicare does not reimburse for institutional care or long-term care, but a lot of that can be supplemented by Medicaid. So those are some of the groups of people that qualify for Medicaid and how they qualify, a little bit of background there. So to recap, today we were talking about what Medicaid and Medicare are, really diving into what Medicaid is, what Medicare is, who qualifies for Medicaid, and just how it can, just so you have a good base understanding of what those programs are. I think as you're getting into healthcare, as you're getting into the space of purchasing an assisted living facility, you need to be aware of what's going on in the industry, be aware of some of these terms, and I'd love to give you some videos on those. Please comment down below if that would be helpful. I can give you an overview of just kind of the healthcare industry. I mean, a lot of you, I think, are getting into this where it's brand new and you're attracted to the asset class because it has good returns, but you're kind of scared because it's healthcare and you don't know exactly what that means. And you need some help with that. So comment down below if having some videos that kind of go over terms and explaining the process of things would be helpful for you. I'd love to get into. I have a lot of experience there with my education, a master's in healthcare administration, having worked in the healthcare industry for about 10 years now. I just have a lot of experience that I'd love to share with you and help you along your journey as you look to get into assisted living. And next time, we're going to be getting into how Medicare and Medicaid work, specifically in assisted living. So I'm going to dive even deeper into these different programs, how they might impact you as the owner of an assisted living facility, so you can kind of understand the process. And just kind of doing a little series here on these government-funded programs so that you have a good understanding of exactly how they work and can help you along your way, along your journey, so that as you get into this, nothing is surprising. I just want to make sure that everything is kind of up there, up front, and you understand exactly what's going on. Make sure you comment down below if you have questions or you want me to dive into more of this content, just kind of the way that the healthcare works. Make sure you like the video. Please give me a thumbs up. It helps other people find this content, and ring the bell so that you get notified when I put new videos out like this. Make sure you're subscribing. Follow me on all my social media platforms, and then make sure you visit me on assistedlivinginvesting.net. I'd love to see you over there. I'm going to have free resources over there. Join my mailing list for future content, and would love to see you over there. Thanks for watching, and have a great day. Thanks.